Okay, chances are you've heard the names Ozempic, Wegovy, Zepbound. We are right in the middle of a massive medical revolution. But, for so many patients starting out on this journey, all that excitement gets mixed up with a tidal wave of questions and honestly a feeling of being totally overwhelmed. What if you could just cut through all of that noise? Well, that's exactly what we're going to do today.
This quote right here, it gets to the absolute heart of the issue. The medication is a breakthrough, for sure. But the real problem, it's the information gap. That's what leaves you feeling lost and confused. So this explainer, well, it's designed to start closing that gap, pulling key insights directly from the handbook to put you back in the driver's seat. So, where on earth did these almost futuristic drugs come from? You are not going to believe this, but the origin story is one of the wildest in all of modern medicine. And it all starts in the American Southwest with a venomous lizard. No, I'm not kidding, a lizard.
And here's how that incredible discovery played out. Back in the 90s, scientists found this powerful little peptide in Gila monster spit that was surprisingly similar to a human gut hormone GLP-1, but it lasted way longer in the body. That led to the very first drug, Byetta, back in 2005. But the real game changer, the quantum leap, happened just recently. The big trials for semaglutide, that's Wegovy, showed a jaw-dropping 15 to 17% average weight loss. And now we have tirzepatide, or Zepbound, hitting up to 22.5%. Those are numbers we used to think were only possible with major surgery.
Okay, this slide right here is going to clear up a huge source of confusion for so many people. You hear about Ozempic and Wegovy, and you might think they're totally different drugs. They're not. They are the exact same active medication, semaglutide. The only real difference is the brand name and what they're officially approved for, diabetes versus weight loss. Same story for Mounjaro and Zepbound. They're both just tirzepatide. Just knowing this one thing is a huge first step to feeling like you're in control. So, how do these medications actually pull this off? Well, it's not about using brute force. It's much more elegant than that. It's about recalibrating your body's own hormonal systems. Think of it like a conductor stepping in to bring a hormonal symphony that was playing way out of tune back into perfect harmony.
The medication is smart. It works in 3 key places, all at the same time. First, in your brain, it turns down the volume on your hunger signals. Second, in your gut, it hits the brakes, slowing things down so you feel full for much longer. And third, in your pancreas, it acts like a genius, telling it to release insulin only when it's actually needed. It's this coordinated 3-part strategy that makes it so incredibly effective. Let's really dig into that brain effect, because for so many people, this is the most life-changing part. Patients have a name for it: food noise. You know what I'm talking about, that constant, intrusive chatter in your head about your next meal, about cravings, about calories. What GLP-1s do is quiet that chatter. And let's be clear, this isn't just some psychological placebo effect. It's a direct neurological effect on the appetite control center in your brain. And what's so fascinating is that it's a 2-pronged attack. So before, it's like your brain's hunger thermostat is broken, always screaming that you need more food. The medication helps fix that, restoring the "I'm full" signal. But, and this is huge, it also reduces the hedonic drive. That's the intense pleasure you get from really tasty foods. It basically makes those cravings way easier to resist. It tackles both the physical need and the mental want. And the results of all this recalibration, they're just staggering. 22.5%. Let that number sink in for a second. That was the average weight loss with tirzepatide in the trials. This isn't just a small step forward in treating obesity, it is a fundamental paradigm shift. We are achieving results that used to belong exclusively to the world of bariatric surgery, but now with a weekly injection.
But as they say, with great power comes great responsibility. This journey isn't always a walk in the park. The incredible results are absolutely real, but to get there safely and to make them last, you have to be prepared for the challenges that come along with it.
And here's what that looks like. Side effects like nausea are super common. We're talking up to half of all patients might feel it. But look at the cause. It's the drug literally doing its job in your brain and your stomach. So the good news is, these effects are predictable, they are manageable, but only if you have the right information and the right strategy to handle them. And the handbook offers this simple but incredibly powerful piece of advice. The #1 mistake, the single most common reason people struggle, is moving up in dose too fast. The mantra is start low, go slow. That simple rule is the absolute key to a comfortable and successful journey, but it's the kind of crucial advice that often gets missed.
Now here's a question that gets lost in all the excitement about the pounds dropping on the scale. Rapid weight loss is fantastic, right? But what kind of weight are you actually losing? This is one of the most critical things you need to manage.
Because, and this is a big deal, without the right strategy, up to nearly 40% of the weight you lose can be your precious lean muscle. And that is a huge medical problem. Losing muscle tanks your metabolism, it makes you weaker, and it makes keeping the weight off long-term so much harder. But the good news? This is almost entirely preventable.
And this is where we pivot from the problems to the solutions. Navigating the side effects, making sure you're losing fat instead of muscle, that requires a roadmap. You need a guide that's based on clinical evidence, and that is precisely what the handbook is designed to be.
So let me give you the single most important principle from the handbook for protecting your muscle. It's this: at every single meal, protein comes first. Always. The appetite suppression from these drugs is so powerful that if you don't consciously prioritize protein, you just won't get enough of it. It's that simple. And the handbook doesn't just give you vague principles. It gives you a concrete plan. This table right here shows you the specific, actionable protein targets you should be hitting every single day. So for a 75-kilogram person, that's up to 150 grams of protein. This is the kind of practical detail that makes all the difference between a good result and a truly great, sustainable one. But protein is just the beginning. The handbook is a complete roadmap for your entire journey. We're talking about how to use resistance training to build muscle, what lab tests you should be asking your doctor for, how to plan for long-term maintenance, even how to safely transition off the therapy when the time comes. It literally answers the 50 most common questions patients have.
Ultimately, the most important message in all of this is simple. This journey can feel confusing, it can feel isolating sometimes, but with the right knowledge and the right guide, you are not navigating this alone.
And that is what the GLP-1 Patient Handbook is all about. It's your complete, evidence-based guide written by a doctor to make sure you use these incredible medications safely, comfortably, and for the absolute best results possible. If you are ready to close that information gap for good and really take control of your health journey, you can find it available right now on Amazon.